welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Well, it's an honor to welcome back Dr. Alfredo Hoyos, who's been a frequent guest on my Rohrich Knows Podcast. He's a world-famous plastic surgeon in Colombia, but he's really world-renowned for his incredible expertise in 3D body sculpturing, and he's such an innovator. So, Alfredo, welcome.
Thank you very much for the invitation, and thank you very much for making me a recurrent guest here.
Yeah, that's great. Well, it is awesome. It's always awesome helping, just talking to you about all the new things you're doing. So let's get right into it. So you are really become a master of rib body contouring, and I know we talked about it in a previous podcast, and at that time you were just starting to do it. So now you've made it safer, better, and so tell us a little bit about your journey, and where do you think it fits into body contouring today?
Well, I think, we were looking for it. We were trying to search for a way to reduce the waistline in the bony structure. So we had always that limitation,
Right.
So we started this journey in 2020. We actually found out that there was a Russian technique. So we went straight to the source, and it's the technique of Dr. Kutsayev, The thing about it is, as is, the Iron Curtain, not a lot of the things actually travel back to us, So one of the things that we had in mind is that we actually saw the potential in the technique, in the design of the technique itself. And we wanted to create more science around it. It's not that it was literally like Sasquatch or
Right.
like a fairy or something like that. So what the journey actually has been almost 3-4 years already in the making, and we already have several articles that we've published over the years. And right now we have in search of this amount of cases, we actually gather all the fathers of these techniques and combine them together to do a big article. So right now we have mainly 2,000 patients.
Wow.
Of the junction of these techniques that actually have the same base. The base is to create a green stick fracture, debilitating the outer cortical in a way that is lateral to the muscles in the posterior back.
Okay.
So with that in mind, what we do is a controlled fracture, is a green stick fracture, essentially in T12 and T11, but we can go higher up to T10 and T9. Specifically for very difficult cases like difficult scoliosis or patients that actually need it. So having that in mind, what we designed is a way to do smaller incisions. Right nowadays, we actually do a puncture, ultrasonic guidance at the same time to increase safety and have real visibility. And also to gathering those cases and especially connecting what is the indications versus the contraindications. And beyond that, to create techniques that actually can reproduce this. And in case of emergencies, what I say, in case that we have a complication, in case that we have a non-union, in case that we have a callus that doesn't consolidate, to have also techniques that we have behind a glass that says use in case of emergency that we can treat these patients with. So we created also techniques for rescuing a failed technique if we needed to.
Okay. So what is an ideal patient, Alfredo? Obviously, we're talking about rib fracturing and making the waist better. So what is an ideal patient? Is it a male? Is it a female? Or what is it? Is it somebody that really wants to have a totally snatched lower waist? Is that what you want? I mean, how do you?
Exactly. So essentially, we have two indications, and mainly is about the frame that we have. The frame we actually consider there is the width.
Right.
So it's the thoracic width versus the hip width, right? But it's also the length, So patients that have big thorax, small hips, but at the same time, the patients that have a very short distance between the last rib and the costal margin and the iliac crest, to say so. So we actually define a short one when this distance is below 5 centimeters.
5 centimeters. Okay.
So with this technique, the main indication is the patients that have a big thorax, mostly a relationship almost 1-to-1 with one or the other, that don't have another options to reduce the waistline. So for instance, if you have a lot of kids, you have the waistline is expanded, but it's because of the muscles. So there are another options, right? But in this case, is when the patient doesn't have any other options or as an adjunctive to these other options. So we can combine it with a mini tummy tuck or full tummy tuck with plication as well. The idea is that they have to be as young as possible. So usually we begin, in the limit of age that is 18 here, 21 in the US maybe.
Okay.
But the idea is to go as far as 50 years old. Usually we actually measure the index, the FRAX index for doing the osteoporosis index in certain patients. Both patients that have already menopause or that we suspect that they have indicators of non-union or mild union, these are candidates for another type of surgeries. These on the female. On the male patients, I think the main indications is the trans patients. And recently we have been patients that actually are, especially like bodybuilders, that want to have a smaller waistline because they want to actually enhance the musculature in the upper torso as well.
So, okay, how long does the procedure take, and what's the post-op recovery? I know you designed some garments for it, and so just give me an idea.
Yeah, so this is, the idea of the length of the surgery, it depends if we do it with liposuction or without liposuction.
Yep.
But alone, the rib contouring is done in 15 minutes. It's a very quick surgery. Nowadays, we do it with ultrasonic guidance, and we do it with ultrasonic PSO. So it's very quick. We can say that maybe it takes around 3-4 minutes per rib if we actually fracture T12 and T11. So it's times 4.
Right. And you'll show us you'll show some examples, obviously, of this as well.
Yeah.
And that's amazing. And then, how many patients have you done that you've done the percutaneous piezo rib fracture?
Right now, we have around 400 of the cases that are combining the PSO with, actually we used before another type of device that it literally was a drill. So we have around 200 and 200 right now. And the idea is actually to compare, in an article, to compare both of the technologies and see what happens,
And have you done that, or you're in the process of doing that?
Yep, we're in the process to do that, but so far the PSO is winning. We have less burns in the skin.
Really?
We have better recovery in the sense that they have less pain as well. So it's quite interesting because we know that a PSO is literally a vibration in a very high frequency. So it's literally a drill, but in a more condensed way. So, in some essence, we actually knew that it was going to happen. We actually started with the drill because we were afraid that the PSO tip would break inside, So we started with the drill that is, literally made of steel. So we know that it wasn't going to break. Later, we found, we designed a new tip that is actually made of titanium. So it's far more sturdy in a PSO tip. So we are pretty sure that it's not going to break inside the patient. So with that in mind, we actually can compare a little bit of both worlds.
Good. So I know you've been combining that with a lot of your 3D body contouring, and so it sounds like it's been a game changer, right, in these selected patients?
Yes, the thing is, not everybody has an indication, but it actually is a very, very good choice. And a lot of women, we didn't know this, a lot of women have this concern.
Right.
But as they didn't have any options, they never thought that it was a solution for it. For instance, 2 days ago, I actually showed in my Instagram a patient that was done in our Congress. So she's like 3 weeks away, and with a combination of high def and reps. We had more than 150,000 views, and 120 patients want to have the surgery. In 20 hours, we had this amount of patients. So it's something that it is slowly gaining momentum because, when you say to a patient, we're going to break your ribs to get your waist smaller, they say no. So, but if you show them that it's safe and that we increase it, that we increase the safety, that we increase the number of cases without having problems, and the results are amazing. So the patients actually are more willing to do so.
Okay. Well, that brings me to obviously the point about safety and your take homes. Is that so? How do I find? I mean, of course, I send everybody to you, Alfredo. You're a world master, and I do, as you know. What should the viewer know before they go? Because this is a new technology, a new technique, and you know, you make it obviously because you've done the science. So what should they know before they go and before they? Some guy says, "Oh, I'm going to break your ribs." I mean, because obviously this is not an insignificant technique.
Yes, it's very important. I'm glad that you asked that question because it's a new technique, but it's also playing a little bit with a field that we are not very comfortable with. You know,
right?
That is literally the bone structure. So I think the first is that it has to be a plastic surgeon.
Right.
Recognized and actually has like a board certified one.
Yeah.
And second, you need a special training for this. You know, it's not something that you see in a book and later you try it in the next patient. It's not something that you watch in a video and you're ready to go.
Right.
You know, so we have mainly like a ladder system to do the training. We start with an online training. Later we do an animal model training, and later the surgeon can go into that. So we have like a program that is a 2-day program that has all three. You know.
Okay.
And with that, we actually can be more sure that the doctor has the proper training for doing this.
Okay. So board certified plastic surgeon, specific training to do it, and then obviously way beyond videos. You know, attending your meeting or your course and really getting it done. I mean, you've trained so many surgeons in the U.S. and all over the world, and you know, it's amazing. And the sign of a great teacher is one that actually the students actually know how to do the procedure and do it well. So Alfredo, as usual, incredible advice, wise advice from an amazing plastic surgeon. Know before you go, but he is truly the guru of body contouring surgery, now of rib contouring surgery. So thank you so much for your time. And if you have any questions or comments, please reach out to me or Dr. Alfredo Hoyos, and we'll help guide you. Know before you go.